There's been a ton of changes in concussion management in like the past 10 years, and a little bit longer than that too. But there's this whole cocooning philosophy of just saying, oh, you got your bell rung, you got your concussion, rub some dirt on it, sit in a dark room for a couple days, and you're going to be fine. Like, get back out there and play. And that's really just old information as far as like how we approach this from a healing perspective. Hey, I'm Stephen Line. I'm a primary care sports medicine physician that works with Texas A&M and Texas A&M Athletics. I am a current assistant fellowship director for the Primary Care Sports Medicine Fellowship Program and a clinical assistant professor with the Department of Primary Care and Rural Health. And I hold the blessing and opportunity to be able to work with a lot of our family medicine physicians and sports medicine fellows that work with Texas A&M. I'm actually a fourth generation physician, and so my great-grandpa was a general physician, a general practitioner. My grandpa was a ear, nose, and throat doctor. My dad's ear, nose, and throat doctor. And then I got into medicine from an early age, and I remember delivering water in the local hospital to be able to get my first experience and working in the mailroom. So it's been a long journey to get here, but finally made it to my ultimate goal to be a physician. And how I specifically got up into sports medicine is I had great mentors. And so some of those mentors I met through my family medicine residency in Austin, and then they introduced me to the field, and I just have had a blast doing sports medicine coverage and learning about comprehensive care of the athletes. And essentially concussions has become my kind of baby and what I really enjoy and what really has become kind of my subspecialty. So that's been really fun. How I ended up at Texas A&M is I finished my family medicine residency and then ultimately did my primary care sports medicine fellowship here. And then after I graduated, I became a faculty member. And so once I was a faculty member here, I started looking for ways that I could make my own mark and my own impact on the program. And I started a concussion specialty clinic. Actually went to a national sports medicine conference where they were talking about opening up your own concussion clinic within your practice. And I kind of made that my own and was able to create something within the clinic that I'm housed at Central Texas Sports Medicine to then be able to offer these services, which is really like NCAA Division I level concussion care to our high school athletes and our club sport athletes for A&M, and as well as other athletes like from Blinn College and a variety of different sports in town. So that's been really fun. In the past year, I've seen over 100 concussion cases within like a 6-month period. And so it's high repetition, high volume, and being able to offer like a higher tier and a higher level of concussion management has been really fun. So with respect to my research interests, I would say that concussion and research within the concussion field, and specifically sport-related concussions, is probably what I'm most passionate about. And that's what I've been kind of focusing my efforts on since I've been a clinical faculty member here. That really stems from the fact that there's a lot of information that's still becoming known about concussions, and specifically with our athlete population, how we can get them back to play faster and in the safest way possible. So one of my specific interests has to do with osteopathic medicine and manipulative treatments. And so I'm a doctor of osteopathic medicine, and so how that kind of plays a role into using all those skills that I learned as a DO from my medical training and then applying that to our student athletes and how that can really impact their recovery. That's really what I'm focused on right now. So osteopathic manual manipulation or osteopathic manipulative treatment is basically a form of manual medicine that is specific to DOs or doctors of osteopathic medicine. And it's a hands-on technique. There's lots of different things that we can offer to a patient based off of a focused structural exam. So first things first, we usually evaluate our patient, put our hands on them, feel what sort of tissue texture issues are going on, or any somatic dysfunction issues that are going on, or applying that to their specific diagnosis. And a lot of osteopathic medicine within the concussion realm has to do with cervicogenic and cervical issues and thoracic issues as far as what we're focusing our structural exam on, and then ultimately how we're going to make that diagnosis and then offer specific treatment options. So it's not necessarily just like popping and cracking that you might kind of think of manual manipulation, but there's a lot more subtle techniques. There's myofascial techniques. There's lots of different options that we have available to us. So I think it's really a cool opportunity to be a clinician and an academic physician, because you can bridge that gap between both the clinical side and the research side. And I think that being a lifelong learner is a part of being a physician and being a healthcare member of the community. And so part of how I've seen myself and being helpful here is not just being a good academic doctor by producing research papers, but is also to like make an impact in that field that I'm really interested in. And so I have a really awesome subset of patients that I'm able to work with through Texas A&M Athletics, and I'm one of the team doctors for all the student athletes, but I get to work a lot with the football student athletes as well as the soccer student athletes. And so through those connections and relationships that I built with the university, they were all unwilling and bored to be able to help us out with this project. And the student athletes have been really wonderful and have given great feedback to the treatments that we've been able to offer and how that's made them feel afterwards, and just our general approach. So it's been really fun to be able to bridge that clinical gap, and it's a cool opportunity to be able to make an impact on a really driven and motivated population of patients. The work that I'm specifically doing right now in concussions and how that applies to athletes is the really awesome part about that is it's very expandable. And so I'm working specifically with a subset of NCAA Division I athletes, but ultimately this is something that could get applied to middle school students, high school age students, and ultimately professionals or recreational really. And so there's a very broad net that should our research show that there's some really positive impact from doing osteopathic manipulative treatments in the kind of acute setting of concussions, then it might really make a big impact within the sports medicine community in general, because they might be able to have more of these treatments delivered early on in the care of sport-related concussions. And so that's kind of what I'd be excited about. Even if it doesn't show in the research that ultimately that there's a huge impact on return to play, I will say that just subjectively, a lot of the feedback we've gotten from the 8 participants we've actually been able to perform this on so far, it's been really positive. They've all had a really good experience with it. They felt like their symptoms have gone down. So it's really, can we just connect that research and that data to be able to show, is that something that's actually going to lead to some meaningful data-driven return to play recovery and decisions. Couple, I guess, misconceptions that there would be about like the research that I am specifically doing is that there's been a ton of changes in concussion management in like the past 10 years, and a little bit longer than that too. But there's this whole philosophy in the past, and what I have to really explain to a lot of parents of like my middle schoolers and my high schoolers when they come in to see me is the whole cocooning philosophy of just saying, oh, you got your bell rung, you got your concussion, rub some dirt on it, sit in a dark room for a couple days, and you're going to be fine. Like, get back out there and play. And that's really just old information as far as like how we approach this from a healing perspective. And so a lot of what we really focus on now from just a whole person, whole athlete approach to care and concussion management, and really offering an expertise level is data-driven, is exercise is actually helpful, but in a controlled setting. And so we try and do testing to see sub-symptom thresholds, to see how much exercise we can actually get you to go to with respect to your heart rate, so that you can actually get some blood flow to your brain, which is actually really helpful. There's some helpful supplements that they're still working on some specific data and research to be able to prove if that's something that is beneficial long-term for the concussion recovery, but that's another element that there's a lot of research going into, is the supplementation side of things. The overall just management of concussions is a lot more active. It's not so much just, hey, just avoid screens. It's a lot more about like, okay, we have to recognize that like learning involves screens these days, and so how do we do that well? And so using things like blue light glasses to be able to help people manage their screen time well, and to be able to advise them as far as like how to take breaks from screens and doing 10 minutes on or 5 minutes off, and really just individualizing that care to them. I think that one of the bigger impacts I get to make in my role in education to the patients is trying to fine tune it to them, because no one concussion ends up really being the same. And so walking them through their specific life circumstances and what their specific symptoms are, and then how I can help them through that, like that's what really makes that critical thinking side of my job fun, and also really helpful to the patient at the end of the day. So I applied for and was lucky enough to receive the Huffines Institute J.P. Bramhall Faculty Research Grant, and it was a really cool thing to be able to win, I guess. But at the same time, it was really one of my first adventures into grant writing. And so Dr. Carson and Dr. Yentes are some of the faculty over at Huffines, and they were kind enough to be able to help me kind of walk through that process a little bit as well, and kind of refine that process. But I'm super grateful because it was able to really help me expand and further my research here at A&M. And with some of those funds, I've been able to use that to help support through salary a graduate research assistant who's been just invaluable to our project. And so that's been a really awesome additional component to this, and my growth as an academic physician as well. So that's been really cool to walk through as well. So it's been a cool experience because just being involved with the Huffines Institute and all the resources and power and being able to leverage all that has connected me to like library support services at A&M. It's been able to support me to the more members of the kinesiology department that are just a wealth of knowledge, and then on top of like the expertise in grant writing that the Huffines Institute has, and just great mentors and colleagues and friends as well.